talk about anxiety disorders. So, what are anxiety disorders? Well, we've already kind of covered what anxiety is, but for the sake of this lecture, we're going to define it once again. So, anxiety is the nervousness or the agitation that we sometimes experience, and it often comes from something that is going to happen or could possibly happen. So it's all about being nervous or worried about something in the near future or the possible future. And anxiety disorders stem from this, but they are more disturbances marked by irrational anxieties. So they aren't so much the going to happens, but the could happens. And they don't have any sort of logic behind them. And they're often from everyday objects and situations. So the anxiety can just stem from any sort of object or situation within your environment that you come across in everyday life, and that will trigger some sort of nervousness or agitation, and it won't be for any sort of rational reason. So what are the possible causes for anxiety disorders? Well, genetics is definitely a possible cause. Similar to depression, it's found that if you have relatives that have anxiety disorders, you are also more likely to develop an anxiety disorder as well. Environmental factors such as stress or trauma can also trigger anxiety disorders. You can also be classically conditioned to have an anxiety disorder. So you may just overgeneralize a certain thing that makes you scared. You might, a specific dog, for example, could bite you, and so you don't like that dog. You're scared of that dog. But then you generalize that to all dogs, and now you're scared of all dogs. Or you learn to avoid certain situations because in the past, those situations have not been good for you, and they've caused anxiety. And it could be natural selection. Anxiety is actually a tool for us. This is an adaptive tool. It keeps us alive. It's adaptive to be fearful or uncertain to dangerous things. But unfortunately, sometimes our anxiety can get out of control. So this might just be our adaptive instincts going a little too extreme. So the first anxiety disorder we're going to talk about is called generalized anxiety disorder, or GAD. And this is when someone has nearly constant anxiety that's not associated with any specific thing. It's just excessive worry and distress about pretty much all daily life activities. Pretty much everything in their life can give them anxiety. They tend to overthink everything, and think the worst possible scenarios of what could happen. They worry about everything in their life, and so this anxiety is constant. They're in a constant state of anxiety. It's not specific to any sort of object or situation. It is just a constant for them. And what is troubling is a person with this disorder, is very aware that their worries are exaggerated and or irrational. So they know that they are thinking of the worst possible situation, and that's probably not going to happen. But they can't help but think that way. And they know that they might convince themselves that their friends hate them but that's not a rational thought. There's no evidence for that. But they're still convinced of it. They're still worried about it. It doesn't, just because they're aware that it's exaggerated or irrational, does not stop it from happening. And this causes significant distress and dysfunction in daily lives of people with generalized anxiety disorder. They are in constant war with themselves. They're constantly worrying and distressed about everything in their life. And this can cause major dysfunction with their work, with their social relationships, with schoolwork. But to qualify as generalized anxiety disorder, all of this must occur for at least 6 months. And other symptoms of generalized anxiety disorder include irritability, restlessness, muscle tension, specifically in the neck, back, or jaw, headaches, sweating, difficulty concentrating, nausea, fatigue, and being easily startled. So that startle response that we talked about with those mice in classical conditioning. People with generalized anxiety disorder have a strong startle response. Then there's panic disorder. Panic disorder is when someone has recurring episodes of panic attacks. And a panic attack is when there is a sudden, overwhelming terror, sense of terror and doom that's accompanied by hyperventilation, chest pain, choking, and other really frightening physical sensations. So it's mental terror and doom accompanied by these physical sensations of choking, chest pain, hyperventilating. Your muscles can tense up, your hands can clench together. What a panic attack feels like, it feels like, people have reported that it feels like you're having a heart attack, like you're dying, and like everything is doomed. So you can actually have these feelings before and during a panic attack. So if you start feeling like everything is doomed and you notice yourself breathing fast and shallow, practice breathing slowly because you might have a panic attack coming on. But the good news is panic attacks don't last long. They last around 15 minutes. They are terrifying though. Those are very terrifying 15 minutes, but they will be over soon. Then there's phobias. Phobias are when you have a specific and irrational fear of a certain object, situation, or activity. And the phobia must substantially interfere with the person's ability to function. So we all have fears. We are all afraid of something or some situation. But most of the time, those fears don't substantially interfere with our ability to function in everyday life. If that fear is around us, then yes, maybe it does change our ability to function. But if it's not around us, we're fine. People with phobias cannot function even when they aren't around the thing they're scared of. So people can have a phobia of pretty much anything. This includes snakes, spiders, heights, close spaces, flying, water, and even holes. People can have a phobia of holes. So some of you may have cringed when the spider came up on the screen. So you might have a fear of spiders. That does not necessarily mean you have a phobia of spiders. So if you see a spider in your house, you might freak out. That is a fear of spiders. That's okay. That's not necessarily a phobia. But if you are constantly checking all of your furniture for spiders, and every night before you go to bed, you undo all of your sheets and redo them to check specifically for spiders, um, then you may have a spider phobia, which is called arachnophobia. And then there's this really interesting type of phobia called agoraphobia. And agoraphobia literally means fear of the marketplace. And what this is more in detail is that it is fear of being in a situation that is difficult to escape from. So people with agoraphobia tend to not leave their house because they are afraid to go anywhere that they cannot easily run away from the situation if something bad happens. So this is a good illustration here. So say someone's on this bus and they're thinking, I can't exit the bus. And they're panicking because they can't escape from this bus. And so now they're sweating, they're breathing fast, they're trembling, and there's nowhere to hide on the bus. You can't even get outside because the bus is moving. So that is how someone with agoraphobia feels, is even in a large crowd of people, you can't easily get out of that crowd. You can't easily get off of a bus. They tend to just stay home because they don't need to escape if they're home. And agoraphobia frequently occurs with panic disorder because the panic attacks, the episodes of panic attacks, actually can cause agoraphobia if they have a lot of panic attacks in public places. They can associate those panic attacks with the need to escape and the inability to escape. So it's a big panic they start to panic when they feel like they can't escape because they are worried that they're going to have a panic attack. So they're like, uh-oh, I'm in a huge crowd, or I'm on a bus and I can't get off or can't get out of this crowd easily. And what if I have a panic attack again? Oh no. Oh my gosh. And so they freak out and then they have a panic attack. And so then that just reinforces their idea of, I shouldn't be here, I should just stay at home forever. Then there's social anxiety disorder. It's also called social phobia, so it can be clumped into the phobia category. And this is the fear of being negatively evaluated by others in a social setting. So this could be fear of public speaking, meeting new people, eating in front of others. This is an extreme fear of being judged or embarrassed. And everybody's a little bit afraid of that, right? We don't like being negatively evaluated. We want other people to like us. But what makes this a disorder is that it causes a significant avoidance of social situations because of this. And that has to last for at least 6 months. Then there's OCD, obsessive compulsive disorder. So what happens with this disorder is unwanted thoughts, which are the obsessions, are followed by actions, which are the compulsions, to relieve them. So the obsessions are recurring, so they're repeating, they happen all the time, invasive and unwanted, so the person can't really control them very well. Anxiety-producing thoughts. So they're constantly occurring unwanted anxiety thoughts. And then the compulsions are the irrational and uncontrollable repetitive behaviors that are aimed at reducing the anxiety from those anxiety-producing thoughts that are the obsessions. And there are 3 common types of compulsions that are called the 3 C's. So there's counting, cleaning, and checking. So People often count when they have OCD. They will feel like they need to flip. If they leave a room, they feel like they need to flick the switch of the light at least like 3 times exactly before they can leave the room, or else something terrible is going to happen. Cleaning is also a very popular one. If their obsession is germs, if they're afraid of getting sick or they're afraid of germs, especially if they're afraid of like handshakes, if they often will wash their hands repetitively, and then checking. Sometimes people will repetitively check their front door before going to work. So they will get halfway down their hallway, go back and check their door, and this will take them 30 minutes or to an hour maybe to do before they can feel confident enough, feel their anxiety is less enough to go to work. And then they're late to work because they spent an hour going back and checking their door 30 different times. So this causes a lot of distress and dysfunction because the compulsive behaviors are usually really, really time consuming. So the counting, usually you're doing a task multiple times that you really only need to do once. And you're cleaning an excessive amount. And you're checking things an excessive amount. So this really interferes with being able to do the other things in your life that you need to do. So the cycle of this is really, so you have this anxiety. This is a person who has the anxiety of germs and contamination. They really don't like germs, but they are forced to shake someone's hand. And so that really, that obsession, that thought of taking someone's hand, that gives them anxiety. So they have to run to the bathroom. They must wash their hands, and that relieves their anxiety because now their hands are clean. But they might have had to wash their hands for 3 minutes straight. They might have had to wash their hands 5 different times. But once they do whatever they need to do, then that's the relief. But the obsession comes again, where the fear of contamination is always there. So they're always worried about the germs. They're always worried that they are going to be contaminated or get sick. So that is relieved by that compulsion to wash their hands obsessively. Then there's post-traumatic stress disorder, or PTSD. This occurs when someone has experienced or witnessed a traumatic event, and this can be a lot of different types of traumatic events, including a natural disaster, war or combat, a serious accident, so this could be a car crash or a serious injury of some sort, any sort of serious accident, a terrorist attack, and rape, and or any other sort of personal assault. What's interesting, though, is only 10 to 35% of people who experience trauma develop PTSD. So if you experience a traumatic event, you're not guaranteed to get PTSD. It doesn't happen to everyone. It is probably due to some sort of genetic predisposition, but we're not entirely sure why this occurs. And the main symptoms for PTSD are reactivity. So people with PTSD often become very irritable, aggressive, and hypervigilant. So hypervigilance is when they are overly sensitive to stimuli. So They are overly sensitive to sounds in their environment or to movement or something like that. Then re-experiencing. So if they have nightmares or flashbacks or just simple things in their everyday life remind them or trigger them of the traumatic event that happened to them, and it causes extreme distress, that would be re-experiencing. And then they have to have the avoidance too. So they will avoid trauma-related thoughts and reminders. So if they see something in their everyday life that reminds them of that trauma, they're going to avoid that. They're going to try and run away from it, try to not have to interact with it if they can. And this can often lead to them isolating themselves from family and friends, because they can have a lot of different things remind them of the trauma they experienced. And then they also have a lot of negative thoughts. So they have this isolation, the decreased interest. It's often PTSD is accompanied with depression. So these feelings can be similar to the feelings of depression. Just very extreme sadness and lack of motivation. That type of thing.